Hi guys. So now we're going to talk about muscles of the abdomen, thorax, and shoulder. So let's start by talking about the abdomen. So here is what we have. You have three basic layers for abdomen muscles, and you have the most external layer, and the muscle that is in that area is called external oblique. And you see how the direction of the fibers is this way. It's like you're putting your hands in your pocket kind of direction. So this is all external oblique. These muscles are all super important in holding your abdomen and helping you to compress the abdominal wall, and also flexing your rotating your vertebral column and flexing it. Okay, so for example, the external oblique is important in rotation, lateral rotation of the trunk, and compression of abdominal column. You also have the rectus abdominis, which is this one. Is those one the muscle important for when they're really strong, is what shows in people as the six packs, right? And this muscle is deeper to the external oblique, but it is in the same plane as the internal oblique. You see how the internal oblique has fibers on opposite side of the external oblique? So internal oblique has similar function of the external oblique. So they all compress the abdominal wall and help to rotate the trunk and lateral flexion of the trunk. The rectus abdominis is also important for flexion of the vertebral column. So what is flexion? This is your column. You're doing this, right? Let's see if our little toy here will work for vertebral column. Muscles on the back, shoulder, arm. I thought I had abdomen. I saw it before. Here we go. So if you look at, for example, external and internal oblique, you can see the movements allowed here. Flex vertebral column. So your flexing is like moving forward, right? Rotate vertebral column. See what's rotation? Makes sense? Laterally flexes vertebral column, side to side. So think about it. These muscles are sideways, right? So they're going to help you with that kind of movement. The rectus abdominis is not going to allow this lateral movement because it's a central muscle. So it's more rotation of the vertebral column and flexion. Then we have the transversus abdominis, which is the deepest one. You see how it's cutting like one layer, two layers for you to see it. And this one is more allowing you to compress the abdominal wall. You know, when you want to take that picture and, you know, on your belly to show when you compress it, that's what this muscle is doing. Okay, cool. So we talked about abdomen. We already talked about respiration. Let's start talking about other muscles from the thorax. So now anterior thorax. So we have the pectoralis major, which is this muscle here, right? The deltoid that attaches to the clavicle, just like the pectoralis major, and to the humerus. The pec major attaches to sternum, ribs, costal cartilages, and to the humerus. Okay, so these muscles are important not in chest type of movement, but in arm movements, right? So what is the pectoralis major going to do? It's going to adduct the arm. So it's the opposite movement from the deltoid. So the deltoid makes you abduct the arm, and then the pectoralis makes you bring it back down. Okay, so that's adduction. And then from here we also have the serratus anterior, which is this muscle here. You see how it looks serrated? All this is serratus anterior. This muscle is super deep, so it connects to the ribs, and in the back it connects to the anterior portion of your scapula. You see how the scapula is here? It connects here. So if you would touch somebody's back, you would not be touching the serratus anterior, because it's in the inside, it's in the anterior side of the scapula. What is this muscle responsible for? You know, when you plank, if you didn't have serratus anterior, your scapula would fly out. That's how important this muscle is. So it's more for stabilizing the scapula, okay? Holding the scapula in place. Now let's talk about posterior thorax. So from the posterior thorax, we have the trapezium, many different insertions, you see. So the trapezium is responsible for retracting the scapula and rotating the scapula when you rotate the arm. So this, whatever gives scapula movement, is going to end up allowing arm movement. Makes sense, right? So it's arm rotation. So this muscle, the origin is in the vertebral column, part cervical, part thoracic, and the insertion is in the spine of the scapula. So remember, the spine of the scapula is site of insertion for the deltoid and for the trapezius. So when the trapezius pull, think that you're retracting your scapula, moving it backwards, right? And it also helps in the rotation movement of the scapula. Latissimus dorsi, also origin in the vertebral column, but now we're talking about lumbar, right? Lumbar vertebral column mostly, and attachment to the humerus. What is this muscle going to allow? A muscle in the back, all the way in the lumbar portion, is going to help you with arm movement. It's going to allow arm extension. So you flex and then you extend. You bring the arm back to anatomical position. Let me see what I can find in our friend here that shows the movement. I had the best app to show you guys all this, and I lost access to it. I cannot access anymore. They don't give it to Georgia State anymore, so I cannot continue to use that. I was very sad about this. So we go back. My God, it's raining and thundering here really bad. Let's go to muscles that act on the back. Let's see if we can find. That's not what I want. These are the ones that help with the vertebral column stabilization, and we're not really going to talk about those. We're talking about muscles that act on the shoulder. Arm, wrist. I think maybe here. Let's see. Levator, scapula, rhomboid. No, these are all for, okay, we have trapezius. Yeah, okay. Trapezius and serratus anterior. So let's look at the trapezius. Yeah, I don't have the movement for all the muscles here, but at least we can see some. Latissimus dorsi would be the extension. I don't know if we have it here. But we have the trapezius. So let's look at the trapezius movement. Elevate scapula. See? It's like elevation. And then upwardly rotate scapula. So that's what the trapezius. There are 3 belly, so that's why it allows so many movements. So it rotates up the scapula. Extends neck. We didn't talk about this one. There are different movements, so the ones that I really want you to focus are the ones that are in blue in the book, okay? Another movement, adduct scapula. So it's bringing the scapula back, like retraction, right? And lowers the scapula because of this belly, right? And upwardly. So it's a big muscle, so it is involved in many movements. So just remember the ones in blue, okay? And now we're going to talk about muscles that are part of the rotator cuff. The rotator cuff is mostly the elbow, the shoulder joint, okay? So you have here teres major, behind or anterior to the teres major. It doesn't show in this picture. Don't have another one. It would be the teres minor. So the teres minor is one of the responsible for rotator cuff movement. And then you have this muscle here, which is the supraspinatus. And then this one here, which is the infraspinatus. So one is on top of the scapula, one is on the bottom. One is on top of the spine on the scapula, the other is attached to the part inferior to the spine on the scapula. And then you have the subscapularis, which is in the anterior part of the scapula and connects to where the serratus anterior attaches, right? So there is one on the other side, that is anterior side of the scapula. Remember the subscapular fossa? That's where the subscapularis is attached. So these muscles are responsible for shoulder movement, okay? So they help with the scapula movement per se. So they help to extend and medially rotate the arm, adduct the arm, and abduct the arm. So you see how you have different muscles that end up working together on these movements, right? And with this, we end the second part. I'm going to see you again in the third part where we're going to talk about arms and legs. Bye-bye.